to another episode of Spilling the Teeth. I'm your host, Alan Mutton, and today we're joined by Dr. Padma Gadiyar, practice owner turned tech founder and the driving force behind Smilo.ai. After building and scaling multiple dental practices, Padma saw firsthand the challenges of patient engagement, compliance, and growth, especially during COVID, which led her to step into the world of AI and digital health innovation. In this episode, we explore how AI is reshaping dentistry, the critical balance between innovation and regulation, and what practice owners really need to know when safely adapting to new technologies. So, let's get into it. So, for listeners who may not know your story, can you give us a quick overview of who you are, your background, and how you went from clinician and practice owner to the founder of Smilo AI?
Thank you. Yeah, it's been a journey in itself. I started as a dentist, migrated to Australia, finished my Australian Dental Council exams, and jumped into practice ownership. Was going great, went from one practice to two practice to three practice. It was growing really well. I was enjoying it. And then boom, hits COVID. And in COVID, the challenge was to be in touch with the patients. Even before that, I had written a book called Buy, Bill, and Sell, which was more about making practice owners more aware of what kind of KPIs they need to track. So I was already consulting on that with other dental practices, and I was seeing a common trend. We were all spending all this money and energy to engage with our patients, acquire new patients, but there were so many patients that were not rebooking or converting or something like that. On top of that, now the complexity of COVID, that we can't see patients, and we all have built our practice. It's like a legacy for us, who have moved from the transition of being a dentist to practice ownership. It's a legacy for us. And suddenly we are seeing that legacy being, shaken, and there's cracks. I was like, what do I do to be in touch with the patients? And during that time, there was a lot of work being happening in X-ray AI and all these other fields. And I said, I need to do something for the patients. I want the practice to connect with their patients better, but at the same time, something that improves access and gives the control back in the hands of the patients. That is what was my journey. So tech, my background is not into tech, but I then landed into tech and AI.
Amazing, amazing. And that's a really cool journey as well, to go from so many practices as well to bring it all together into trying to help others as well. And yeah, obviously, as you said, like your journey made you want to help others more. And I guess that talks to my next question, is like, because you've sat on both sides of the fences, right? So you've done the clinical dentistry, you've done the healthcare technology now. So how's that journey kind of shaped the way you think about sustainable growth in dentistry, like especially when it comes to like compliance, regulation, that kind of stuff?
Whether it is building a business that is face to face, that is the brick and mortar business, or it is building tech, I think the fundamental because I'm a clinician, the fundamental was to build around compliance. For example, the right consent, the privacy guidelines, to make sure you have followed. Like in practice, we do audits and accreditations to make sure we are compliant. And it's the same thing with respect to tech. You're making sure you've got the regulatory clearances. You're doing the security testing. You making sure you're within the privacy guidelines. I think because I came from a healthcare background and I'd built multiple brick and mortar businesses, that concept of compliance was very strong in me.
Mm.
And for me, that is a non-negotiable, because if the foundation is not strong, whether it is for a business that is a brick and mortar or tech, you can't scale then. Forget about sustainable growth. You cannot scale. So having that mindset from the start, if you're doing any transition like that, it is very important that you have your foundation strong, stable, your team, yourself, the regulatory bodies are all aligned.
Yeah, and I think that often gets disconnected. You know, dentistry is rapidly adopting loads of digital tools at the moment, and especially AI and at this very moment. But there can sometimes be that huge disconnect between sort of innovation and regulation. So where do you see the biggest disconnect around data, privacy, virtual care, those kind of things?
Look, I think the biggest gap I see is the speed. like how
Mm,
the technology is evolving. Are we able to keep up with the speed with regulation? Like there is policies in place, but it is still under examination. People who are making policies to adoption of the policies to the implementation and who are building tech, there's a huge gap. So making sure that that speed is the technology innovation and regulatory keep up with the speed, but also understanding that data privacy, the hygiene of the data that we all have access to, all of that is also put under a proper schematic labeling or annotation that we call it, is also very important to keep up with that speed. On top of that, anyways, we know adoption
mm.
is quite slow, and that probably needs a bit more funding into that area as well. So I see huge gaps in people understanding what problem they are solving with AI to how AI is being built at the moment.
Yeah, yeah. I think a lot of this as well can feel quite overwhelming to practice owners as well when they see it all. You know, it's one thing buying a product and it's another thing sort of trying to feel like you really understand the compliance, ethics, concerns around it, that kind of thing. What do you think is the most practical way that a practice owner can approach compliance without trying to be the expert in everything?
Look, practice owners are already overburdened with work. Most of the practice owners are clinicians in their practices. They are seeing patients 9 to 5. They are mentoring the younger graduates. They are, navigating stocking issues to staffing issues to paying off their bills. So there's already a lot of stress going on there. On top of that, now the complexity of adoption of technology, migration, and then keeping up with the regulatory bodies and doing it compliantly. It's like doing any course. Like if you are upskilling yourself into implants, wouldn't a practice owner spend time to go and learn and do those courses to be medically safe? It's the same
Mm.
thing with technology. They'll probably need to, educate themselves a little bit more, but when they make a decision, they also will have to identify, okay, where is the data being hosted? Is this technology tested, validated, regulated? All these kind of questions. What sort of consent do I need? What sort of information do I need to send to my patients and staff beforehand? Does it need any training or extra handholding? I think it's exactly like how we would do any course to upskill ourselves. I would say they educate it with the maybe 2 hour session with that product company or an evening, on a topic called AI in dentistry.
Yeah, for sure. And I think it's that AI part as well that can be so intimidating to dentists. But I guess from a regulatory, ethical perspective, these things we're talking about today, like where is AI already being used safely and responsibly in dentistry, to kind of give some reassurance?
Look, safely it is being used. Responsibly, it depends from company to company what sort of explainability and validation they have done. And we see that not many have done it properly. So let's not go into that. So safely, I think it is being used for AI imaging, that is for X-rays. Again, it is only a clinician decision support tool. It's not a diagnostic, it's not a complete diagnostic thing. AI is being used in scribes at the moment and quite actively being adopted by clinicians because writing notes is one of the biggest hassles for all of them. So I think there is a great use case there. I think the third one is definitely into AI voice agents for reception and definitely for recalls and things like that. And most importantly, I believe if there is no patience in the practice, we all know we don't have a business, and AI being extensively used for screening, triage, patient engagement, and education.
Yeah. When you built Smilo.ai, like it's very clear to me, like from an outsider looking in, that it was really important for you to design them with compliance to data security right at the core, and you didn't sort of treat those as things that you look to adapt to do later and fumble across. Like, why was that so important to you? I guess up front when you were building Smilo.
I think it was because I'm a dentist. I think I should give credit to the profession I'm from, because for us, when we do, when we treat a patient, explaining it to them, getting their consent, getting their buy-in is very, very important. So even though it was a startup when we started it, I could have just built just build the software and said, let's use this. I didn't do it. From the start, our foundation was on making sure we followed the policies and the guidelines. Everybody says to me, why did it take you so long to build it? Because we invested into patenting what we did. We went into
Mm.
a research driven, evidence based approach. We actually validated our systems. So it was not just about let's put it in there and see how it goes. It was very systematically approached, because scaling, once it has got the strong foundation, is very easy. But if you have scaled and your base is not strong, your business will collapse. So I think that mentality I had even as a practice owner, I think it just
Mm.
got translated there. So I have to credit, being a dentist and probably going through the Australian Dental Council exams. We as dentists are a little bit more careful than regular techies.
Yeah, no, that's a really good point, and that's something that a lot of people don't raise. Giving the credit to dentistry rather than sort of trying to take the credit away. That's a really nice answer, and I thank you for that one. So going to the virtual consultations, remote monitoring, AI assessments, that kind of thing, all that stuff that you're talking about, and that's especially when it pertains to Smilo. Obviously, there's a lot of regulation questions there, and you've built that from the ground up, but do you see policy changing or evolving in the future to sort of enable these models more, or do you think that they're sort of steadfast the way they are?
No, I think it's already there, because we saw that COVID educated people on telehealth. So
Mm,
the uptake of telehealth made the education very faster into embracing teledentistry or virtual care or asynchronous care. And then now we have these specialized telehealth brands that do a lot of asynchronous care before, via prescriptions or intake forms and things like that. So patients are slowly getting are warmed up to it. So when we are
mm.
trying to build it for dentistry, the policy is already there. So we just have to adjust to those policies around it and build it. And patients, if you look at it, are used to online shopping, all sorts of things they are doing on the phone. So why not bring dental health or dentistry into the phone? That's a simple thing. It's a gradual transition. If our industry does not embrace it, we will lose our patients faster. Dentistry is
Yeah.
always on the bottom of the list, right? It's not the most toppest priority either for health or for their daily living in most of the cases. With the cost of living crisis and everything at the moment, it's anyways on the bottom of the list. So as a profession, as dental practice owners, as dentists, if we don't adopt technology to go to the patients where they are, I think it'll be too late by the time we think, oh, or we didn't do.
Do you think it will become an expectation for patients rather than something that just really good practices do in the future? Like, say in 5 years' time, do you think patients will expect this kind of care?
Absolutely, absolutely, 100%. It's like how digital X-rays have been considered a norm in the practice now. It's about
Mm,
getting a SMS from the practice a day before their appointment confirmation has become a norm now. All this kind of things has become normalization. I am 100% or maybe even 200% sure that in 5 years, this will not be a technology that will be optional. It
mm.
will be 100% to be used, because look at it, you can avoid unnecessary visits when you can avoid unnecessary visits for just a follow up or something like that. You save the patient's time, but also you save the chair time. So all of this, when you add up, patients will want that convenience. They're already asking for it. They
Mm.
want to know, and look at how the chat GPT usage has increased over the years. So with all of these technologies at their fingertips, you think they will not want personalization?
Yeah. No, it's a very, very good point. It's a very, very good point. I guess as well, like not just patients, employees, I guess is, dental practice employees. Like I speak to practices in UK and Ireland, Canada, Australia, New Zealand, the US, all across the world. And the number one thing that keeps coming up is dentistry has this huge workforce challenge in every single territory. It's a global pandemic of workforce. This technology, like, do you think this will change the way we do care, in especially in dentistry, and will ease some of this pressure? And do you think we can do that without compromising on standards?
Look, I think absolutely. The first part of your question, the answer is absolutely. I also want to emphasize it's not just the workforce shortage we are having, it's also the skill shortage we are having. And it's
Okay, yeah.
also that working in dental practices is quite a high pressure situation. So with the new generation coming, we don't know how many will adapt to want to come to dental practices to work. Now, to answer your question, will these technologies will need to be embraced to enable practices to work better, to
Mm,
provide that standard of care. And I believe in 5 years, the standard of care will change. The definition of standard of care will change because of so much adoption of digitalization. I think the standard of care definition will change. Right now, standard of care definition is all with the human touch. If you look at it,
mm,
I think there will be digital touch points added to it. And so the patients will accept it. It's happening in hair salons. It's happening when they go grocery shopping. It's happening at banking. So we as general practitioners and dental practice owners just have to embrace it.
mm. Yeah. I actually want to touch on the point you raised at the beginning about clinician well-being, their skill level, but also their well-being. It's a high pressure environment. From what you've seen across all different AIs in dentistry, like, do you think this AI, smarter systems, new tooling, new workflows, do you think it can actually improve clinician well-being, or do you think there's still a long way to go on that front?
If they are willing to learn and adopt, the answer is yes. And these technologies are built to make you more effective, productive, more standardized and balanced, kind of a
Mhm,
thing. And AI is great in recognizing patterns and relieve that decision fatigue that we dentists have all the time. So, for those who embrace it like it's a tool and not completely be dependent on it to function, I think for them it will be a great way to embrace well-being using AI.
yeah. Okay, cool. That's encouraging to know, right? Like, hopefully, if we can get the good generation of people that want to adopt it, then actually some of those pressures could be
But the
relieved.
problem is, I was discussing this last week with some students, and it was
Mhm,
like, oh, should we get AI into dental education? My question is, you will start using AI in dental education, then you do not have the ability to self-diagnose or anything like that if tomorrow the technology doesn't work one day. So you will not have the power to perform. So
mm,
there is bias there that will you become too dependent on these technologies? So understanding that technology has a role to play, but there is a clinician in the loop that keeps all the things compliant and
mhm,
sustainable is also an understanding every clinician or practice owner will need to get. It's like any procedure. We are used to use digital scanners, or we are used to using digital dentistry for implant
mhm.
preparation, or for all this kind of mock-ups that we do digitally now, all of this we are. But if you ask me, do you know to do it even without digitally? Yes, we all know how to do it without digitally as well. So
Yeah.
I feel there should be a reliance on technology for efficiency, but you should also know independently, if you have to perform, you can do it.
Yeah, it's like you get to level up to the point that you're allowed to use AI in a way. It's a good way
Exactly.
of thinking about it.
Like I said, it should be
Yeah,
used as a tool and not to dependent on it.
Yes, definitely, definitely. So before we sort of get into our sort of closing section, I just wanted to ask you a couple of questions about something you said right at the beginning, and that's your experience of buying and selling practices. You know, you grew from being a clinician to owning a practice to owning multiple practices, and you've done it as well whilst owning a business, which is very very admirable. But a lot of people sort of struggle with that. So you've been very open about it. You've been open about that buying, building, scaling. From your perspective, what makes a dental practice deal ready, I guess? What are the signals?
There are so many factors when we've made a decision we're going to sell a practice. It's about not what makes it. There are multiple things that make it deal ready. Is it the date, like, the patient base? Is it the clinician? Are other clinicians happy to stay? What's the kind of retention strategy and engagement strategy that practice has? Do they have preferred providers or are they not? What kind of technology and what kind of chairs are they using? How's the staff turnover like? So it's about preparing the practices for sale, making sure you made that decision 6 months back and you use that 6 months to get all of these things properly ticked off to get the best return on investment. That is, in dentistry, it could be 3x, 4x, 5x, 6x. But if your numbers are right, the one thing any DSO is looking at is how your patient's recall systems are and
Mhm.
how your numbers are faring year on year. Are you showing growth? These two things, if it's a DSO that is buying you because they are non-dental people, financial guys, these two become their North Star metrics.
Yeah.
And that is where then they will start a conversation with you. So making sure you have given a heads up to your accountants a year before so that they start putting together how the numbers need to look like for the DSOs to assess you, because most of the accountants design their end of the year P&L based on taxation basis. But
Mm.
the P&L that is needed for the practice sale needs to look slightly different.
Yeah. No, that's interesting. And do you think the DSOs do you think one of the things they look at is digital maturity? So do you think that they look at, things like your AI adoption, your data quality? Do they look at that kind of stuff?
Data quality, I don't think is a big criteria at the moment. I've been looking at what the DSOs are doing in the US and all of that. Data quality, I don't think they've still gone there. Digital
Mm.
maturity, yes, it could be a big pointer for them because they are trying to come at your practice and try to grow your practice, right? End of the day, they have to get their return on investment. So they are coming into your practice and they don't want to bring a lot of change if you have the digital maturity, but they want to see what are the extra strategies they can do to grow your business better. So that definitely gets a tick from them, and because they want to just do rapid growth. Theirs is not a sustainable growth strategy. They are looking for a big hockey stick growth. So digital maturity needs to be there to reach the patients better.
Yeah, amazing. Thank you. I think those are really good insights as well. Like, not just for people who are like early on and they want to sort of adopt all this technology, but actually if you're later on, there's still a place for you to go. You know what? An investment in AI, yes, I might be selling in 2 years' time, but an investment now in AI may help my own growth. It will definitely help my patients, and it will help my prospects with selling.
Can also help you increase your top line and your bottom line now, which could be good in translation of your value to the DSOs if you're thinking about selling your practice. I used to engage with a lot of people who wanted to sell their practices, and we used to design how the sale needs to go through. Because I didn't believe in just putting it out there for sale. We used to design. It's like how you're selling a real estate. You put the right furniture and all of, you design everything. We would do the same thing for selling dental practices.
Hmm, interesting. Okay, so as we get into our sort of closing section now, I wanted to ask just a couple more questions. So, for a practice owner who knows that they need to modernize and they've listened to this podcast and they've gone, you know what, I need to get on board with this, but they're still feeling overwhelmed despite all of your great advice. The technology and regulation side is getting them down. What do you think is the single most practical first step that you'd recommend to the person that's feeling that?
I think the simple thing is to start with something small. Read about what you want to bring in. Talk to founders like us who are dentist practice owners and build tech, and start with something simple first. Do not
Mm.
have to bring all sorts of technology all at once and bombard your team and your patients and yourself with all these kind of things. Start with something small. Start with something easy, which has already got integrations with your practice management softwares, which you think is the need of the hours. For example, if you are seeing patients every half an hour, Scribe could be your go-to. If you are seeing a lot of patchiness in your books, it could be us for Smilo. If you're seeing a lot of your associate dentists are missing out on initial decay or poor in treatment planning, use something like Pearl. So figure out what is the need at your practice that can give you the ROI or drive results, and start with something small and easy to go. But one thing that is not compromised, like across whatever you do, consent, data privacy, data hosting are all non-compromising kind of a stuff. So you should be aware of your non-negotiables.
Yeah, good advice. And if listeners are going to take one thing away from this conversation about specifically about future proofing their practice, what should that be?
Look, I think this line is very famous everywhere. It's not the AI that is going to replace you as a dentist. It's the dentists that are learning and embracing AI who are going to replace you. So whether we like it or not, like how digital dentistry and scanning and digital X-rays became part of our practice, AI is also slowly, steadily, sustainably being part of our practice, how we practice dentistry and part of our practice growth. So embrace it, be cautious, ask your questions, but embrace it.
Yeah, I think that is sound advice, and as you say, advice that we hear time in, time out, which tells me it's very good advice. Yeah, get involved, ask questions, be curious. I think for definite. So, okay, over to you. Where can listeners learn more about you, the work you're doing, Smilo AI? Tell us where they can find you.
You can find us on our website, www.smilo.ai. You can follow me on LinkedIn, Dr. Padma Gadiyar. There's a lot of content that we post with respect to not just about our work in dental practices, but we are across aged cares, disability centers. We work with product companies, insurance companies, and in chronic healthcare. So I want to see how you want to be involved with us. You can follow us on Instagram as well. We do have a Smilo.ai page. Please reach out. We've not built it as a company. We've built it as something as dentists we give to our patients. So if you're wanting to be engage with us in any way as an advisor, as a clinician, as an investor, please reach out.
Amazing. And I encourage everyone listening to definitely reach out. Definitely follow Dr. Padma on LinkedIn. Loads and loads of good content there, which is really, really exciting. So yeah, well, thank you very much for that. It was super insightful. It was a pleasure to meet you. Great having you on the podcast, and hopefully we'll speak again in the future when Smilo is even better than bigger than it is right now. So thank you.
Sure, sure. Look, I'm into that. We are on that path of scaling, and we look forward to proving you right.
Thank you
Thank
very
you.
much.